once again, a very warm welcome to all of our attendees this morning. And we just want to say thank you very much to all of our attendees for actually taking the time out on a cold Tuesday morning to be able to attend the Toolbox Talk. As a reminder for those within the next month, in fact, a month's time, the 28th of July, 2022, there is the Plumbing Industry Awards happening at the Royal Elephant Hotel and Conference Center. That is at 6 p.m. For more information, please contact marketing@iopsa.org. Then the tips to continually prevent COVID-19, obviously washing your hands regularly. If this is not available, try and keep that sanitizer that's still there. Avoid touching your eyes, nose, and mouth with unwashed hands. Adhere to your social distancing measures. Cover your cough. Clean and disinfect frequently touched areas, and do your part if you can get vaccinated. Now, just a question that has been raised in the previous few days. Are we still following COVID regulations due to the repeal of regulations that happened under Section 16A, B, and C? Well, to answer that question, what we have done is next week, we've actually included in our Toolbox Talk, are we still under COVID-19 regulations, and what regulations do we still have to follow? So what we've decided is to continue with the theme of taking 5 and staying alive for today's Toolbox Talk, because risk assessments also need to be done. And the same as your DSTI or your planned task observation, like we discussed last week, it takes a little bit of time in the morning in order to get yourself ready. In fact, if you do take 5 and stay alive, this is a theme that we actually want to run for all of the documents that we need to complete on a daily basis. Because if you do take those few minutes out of the day in order to fill in your registers, make sure your checklists are done, and ensure that any inspections on tools, work areas, your DSTIs, your planned task observations are all completed, you have taken time out in order to keep people safe. And hopefully you are doing it with a mindset as well as the motivation to actually accomplish compliance and not just get documentation completed. And if we can get to this type of mindset, that's really where you're going to see a huge improvement, not only in your health and safety, but also in the mentality of your employees, yourself as an employee. You'll feel a lot better at work, because everybody does feel better when they feel safer. There's no indication that somebody is happy when they are under severe stress, especially when their lives are at stake. And so what we want to do is just encourage you to please continue with this theme throughout the rest of your week. So to get into risk assessments, what is a risk assessment? Well, the purpose of a risk assessment is to ensure that the most up-to-date information about the level of health and safety risk posed to persons is available. And that is not up-to-date information from governments or gazettes, like we see the repeal regulations coming out. Yes, all of that has an impact and a factor that plays a part in the overall occupational health and safety industry. But really, it's guys like myself that will then tell you that new legislation has come out and there's new ways that we need to change certain things. For instance, the new hazardous biological agents regulations, those updates meant that you have to have a COVID-19 risk assessment done. And we'll touch base on that next week as well when we discuss what regulations we still have to follow, because it still falls within an occupational disease and it's a hazardous biological. So what we are looking at is ensuring that compliance is there from legislative side, from all your regulations and your laws. But the risk assessment that we are discussing is a risk assessment in order for you to perform your task. That is to identify the hazard and then assess what is the likelihood and consequences of that hazard. Now, the most up-to-date information can only come from you. You are the only person that actually understands the job or the task that you are performing. So whether you're installing a geyser, whether you're digging a trench, or whether you're climbing a ladder, you will know what the most up-to-date risks are. And that is because the risks generally stay the same, but they might change or they might need to be updated because the task needs to be changed a little bit, either because it's very cold in the morning or because the environment around you. So digging a trench next to a wall, well, you have to ensure that there might not be services coming out of that wall. Is there a concrete foundation that you might be digging into? You see, digging a trench is not the same from one place to the next. So the most up-to-date information that we're talking about here is site-specific information. The risk assessments that we give you, in fact, even the one we give you in the template format here on this Toolbox Talk, is all just templates. It's just generic. And yes, a lot of it you can use. When we say using a portable electrical tool, one of the risks is getting electrocuted by the cables. Yeah, that might be able to stay on your risk assessment. But that's not the only risk that you have. So you might have additional risks. Where's that portable electrical tool being used? Who's it being used by? For how long is it being used? And what is the purpose for it being used? Is it just drilling into a wall to put an anchor point in? Or are you using a bigger drill to core drill through an entire concrete slab? So all of those play different factors. So yes, some of the risks will stay the same, but the most up-to-date information can only come from you. Now, what we encourage you to do, whoever is designing your health and safety, what we always ask, and this is something I ask of my clients, the more information you give me, the better. In fact, overload me with information. And the reason for that is then I have the most up-to-date information about the level of health and safety risk posed to persons. And who knows, perhaps one day we will be able to implement a management system for plumbers, for all our IOPSA members, which is so comprehensive that we can give you a documented health and safety file that almost includes 90% of everything you're going to do. And that will just help you then to add in your own little site-specific things that you might find. But this is really what we are trying to achieve for you. So another purpose of the risk assessment is then also to inform the risk manager, as well as the risk assessment team and all employees of the necessary protocols and measures to be taken. Because every time we have a risk assessment done, we identify the hazard, we assess the risk. So what could go wrong? What is the consequence for the person? We're working at heights, they can fall, they can get injured. Well, what we want to put in place then is the protocols or measures to prevent those risks from happening. Now, as we mentioned, you cannot eliminate every single risk. That's almost impossible. So what we are trying to achieve, or what our goal and our target is to ensure that we save as many people as possible. And how do we do that? By getting them to work safely, not by having a document telling us what is the risks, but by actually taking that document and making it practical. So the risk assessment procedure, especially the one that we're discussing now, must form part of your company's risk management approach. If you don't have a risk management approach to your health and safety, in fact, to all tasks, remember, risk management does not necessarily only have to be occupational health and safety. You can take risks on anything, whether it's taking a loan out for your company in order to buy new tools or equipment or a new bucky. All of that is taking a risk. It's a calculated risk because you determine how much you're going to pay back. Can you get more work from it? Might you have to hire a new salesperson in order to get work? That's all risk management. You are essentially taking your business and growing it and hopefully saying to yourself, I'm going to take the risk even though economic pressures are all around me, the rising fuel costs, the rising cost of just general living, and then increasing pay for staff in order for them to be able to be happy to continue working. You see, all of that are huge factors sometimes that affect the risk outcome or the risk assessment of how we are going to run our businesses. And even as employees, even if you're not running your business, the risk of staying with a company with the finances that you're being paid, the risk of maybe leaving and finding another opportunity, is that even possible? You do this all the time. So having that risk approach or risk management approach, applying that to health and safety, saying when I get to a site, what are the risks? What am I going to achieve? What could the outcome be? I want to make sure that the name with my client is 100%. I want quality to be 100%. I want my team to be safe. I want to be safe while working on site. And what does that do? Well, it generates a better control of what risk is going to be faced on site. So sound and effective risk management is obviously a leading practice. And notice it's a means of improving performance. So yes, you can use health and safety to improve performance on site, but you have to want it. You have to understand how it works, and you actually have to implement it. Now, we use what we call PDCA, Plan, Do, Check, Act. I think we've spoken about it before in Toolbox Talks, a number of Toolbox Talks, in fact. And PDCA is actually helping you in every facet of your business, whether it's your quality management system, your health and safety management system, even your production management. PDCA can help you in all of those aspects because it's a continual improvement cycle. So conducting a risk assessment is not just a legal requirement in terms of the OSHA, but it also helps you to then identify what can help and hurt your employees. But that document can only go so far. Once it's signed, generally what happens is it gets put away into a health and safety file and then shelved. But the results of the risk assessment must be made available to the employees. Now, the results, what we are talking about is once the health and safety risk assessment is completed, there's no problem with you sending a copy of this to your employees, even in PDF form, if you don't want them to make changes to it. That's not a problem. And employees, you're allowed to have a copy of this risk assessment. Now, what is it achieving if you have a copy of it? Well, it's for you to be able to read through and understand it properly. Oftentimes, risk assessments are done by myself, sent to you on site in a safety file. It gets signed off, but it actually doesn't get communicated properly. And that's what we actually want to achieve. It's something that we constantly encourage our clients to do. Read through, understand, explain the risk assessment, explain what needs to be done. Because we've had so much feedback from plumbers saying to us, but what you said in your control measures isn't the way we do it on site. And that has helped us to see where we might have been wrong in the application of the risk assessment, because we didn't understand how that plumbing installation needed to be completed. What was the first step, next step, and third step? And when we got that information back, we could adjust our risk assessment, but we did that across the board with all other plumbers that were clients of ours. And that helped them to understand that these are the same measures that need to be put in place. And by doing that, I'm not just improving myself, but I'm potentially helping someone else. And that's really what we want to achieve. So who knows, maybe somebody does something and I assist you next time without you even knowing it, without you even having to pay for it. Why? Because we take that knowledge and information where we've got built up and we try and give it to all of our clients across the board. So why are risk assessments then needed? What is the purpose of us discussing risk assessments for a Toolbox Talk? Because you guys do your risk assessments every day. You do your daily safe task instructions, which is a form of continual risk assessment. So why are we discussing and why do we need it? Well, first of all, as we mentioned, it is a legal requirement. So according to Section 8 of the OSH Act, you'll notice here we've got Section 8.1. Every employer shall provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk to the health of his employees. Now, it cannot be without risk to the safety of employees, because there's always a safety factor or a safety risk when we do work, but without risk to the health of his employees. Obviously, we're looking at ergonomic regulations, the practice of making sure your body stays healthy. So we're going to look at everything from stretching, overreaching, strains, sprains, and stresses on a person's body. And that's why every company has to have a ergonomics regulations risk assessment done on their company. The next thing is hazardous biological agents. And why is that? Well, because you've got occupational diseases, and that's why you need a risk assessment for that part of it. You also need a risk assessment if you expose your employees to hazardous chemical substances, because the hazardous chemical substance regulation says you cannot be exposed for too long, for certain periods, or at all to certain substances without taking the proper precautions. So that is why Section 8.2 comes in. And now we've only got 8.2D because that's the only slice of information that we want you to understand for this morning. It says establishing, as far as is reasonably practical, what hazards to the health or safety of persons are attached to any work which is performed. That is essentially a risk assessment. So understand what the law is actually saying. It's not saying you must have a risk assessment document. It's saying that you have to establish what health and safety hazards of persons are attached to any work which is performed. And it goes on to include things like substances that are used, handled, stored, or anything like that, any plant or machinery that is used. And that is in order to provide the precautionary measures for your employees to take while working with these. In other words, the whole legislation is telling employers that you need this in order to communicate it to your employees. So employees, plumbers, do you have a health and safety file on site? Is there a risk assessment? There should be, there has to be a risk assessment in your safety file. Do you know it? Do you understand what is in that risk assessment? Can you take 5 minutes? Can you take 5, stay alive? Are you able to take 5 minutes a day and discuss one line of that risk assessment until your team fully understands it? I'm not saying you have to have another whole half an hour toolbox talk every day. Just 5 minutes. Discuss 1.1 on your risk assessment, whether that is driving to site, packing your vehicle, getting your vehicle ready, or whatever that point number 1 is, whatever that critical risk is that you have identified. What is it? Do they fully understand what the hazard is? Why we've identified it as the source of exposure to danger? Do they understand the risk aspect of it? What are the consequences and the likelihood? And then do they understand the precautionary measures, those control measures that are there to protect the employees? So employees, if you're saying no to any one of those questions, doesn't mean you have to stop working right now. What we're saying is take 5, stay alive. Take the time, read through that risk assessment, because they are helping you to identify, analyze, and prioritize health and safety hazards. Priority needs to be focused on your high risk areas. If there's something that is catastrophe, causing a catastrophe or could be critical, those areas need to be warranted first. Those are the sections that we will focus on. Then any high risks, then any medium risks, and include low risks. Even if it's a low risk, discuss it, because it is still a risk. Remember, a low risk is still a risk. We don't want to leave those low risks and say, well, you know, it's a low risk, so it's fine. Once we've discussed the high risks, continue to talk about the low risks as well. Then it's also there to identify engineering type mitigation strategies, as well as improving the costing associated with it. Because if we can achieve engineering type mitigation strategies, so we always want to try and eliminate it if we can, but what we ultimately are going to be doing is eliminating of it via engineering. And this is removing the person from the risk if you can. So putting a guard around it, putting a barrier around it, isolating the actual hazard so that the person isn't hurt. And only lastly will we actually include PPE. So what we are obviously trying to achieve with this risk management, or even all small risk assessments, DSTRs, is to develop a critical control management plan. What are the critical areas within our business that needs to be controlled? If we control those first and then slowly walk down to the minor or less insignificant risks, we will then start achieving a better compliance. So how are risk assessments designed? Well, they are designed around what we call a hierarchy of controls. We always want to try and eliminate a risk if that's all possible. And that's the complete elimination of a hazard. And that is doing it by design. In other words, you've got a structured plan in order to eliminate it. Or we can try and substitute it, replace that hazard, replace the material or the process with a less hazardous one. Then we come down to engineering controls. As we mentioned, this is normally where you're going to be working, designing in a control or redesigning the equipment, even placing a physical barrier, so isolating that hazard, guarding it or enclosing it. And if you can achieve this, we don't have to always rely on admin, paperwork, documents, training. We don't want to rely on it. Why? Because it is the lowest form of risk management. So if you are not in the engineering control type and you are in administration, providing training and procedures and the use of PPE, can you see where you are sitting in terms of your risk control? Red. What do you do when you see red? Normally, we stop. We see that as a hazard. We see that as a caution sign, because a red risk assessment tells us we have not done enough to improve our health and safety. So who should be involved in the actual risk assessment? And again, this slide has gone across the board this entire month. As many employees as possible. Remember, the more you have, the employees involved in your risk assessment. Not only will the better their understanding be of what is needed and what should be done to execute a safe process, but you are also incorporating health and safety training into the risk assessment program. And there's nothing better than continually training health and safety to your staff. You should have a competent risk assessor to lead the actual team. A risk assessment must be done by someone who's competent, that understands how to design a risk assessment. But you always want input from the employees actually doing the work. So if you have a risk assessor that's designing it, and they say they don't want input from the employees, they know everything, maybe it's time to relook at who your risk assessor is. They can have all the qualifications in the world, but if they are not willing to include the employees' information into their risk assessment, then there must be a problem there. Because every risk assessor would want as much information as possible. Because the more information we have, the better the risk management is actually going to be. So we want you to understand the tasks, and it's very vital for you to try and include as much as possible any person who has technical knowledge on that information as well. So somebody who's not just a plumber, but perhaps a high technician plumber, somebody who knows all the ins and outs of different types of plumbing, that type of person with a technical brain often looks at it in a different light than just somebody doing the actual installation. And that person can also bring in a different aspect or a different viewpoint on risks and hazards that they may find. So as we mentioned, throughout this whole week, we've been giving you templates. I don't know if you've gone to our website and scrolled down to where it says templates, and I think we've put something else there. We're going to start adding Toolbox Talks as well to the website so that you can go through and download templates and even watch previous Toolbox Talks that we've had included on the IOPS website as well as on our website. But what we want to achieve with this site, and you'll see it's still under construction, we are starting to put a whole lot of templates. In fact, we want to get an entire safety file onto this website so that you can just literally go in, download an entire template of a safety file or any aspect of the safety file that you need. And so what we're going to do is we're going to put it into various documents. So this risk assessment that we've discussed today has actually come from an Excel spreadsheet that we have where it calculates your risk automatically. So you use a risk matrix. The risk matrix tells you, is it a high, medium, or low type of risk based on a 1 to 5 category. So 1 being insignificant, 5 being catastrophe. All of those will then be included, and a little bit of training will be given to you as well in the next coming months on HIRA. So if you're not part of Prime, please get onto Prime as soon as possible. If you're an IOPS member, that 15,000 Rand mentorship course is yours for free. And we are going to be discussing HIRA in the next 2 months. So for this coming month, June, obviously we have legal liabilities. Next month, we've got occupational health and safety representative activities. So if you've got a health and safety rep and their certificate's coming to an end, you can update your SHE-Rep certificate with the training that we're doing next month. Save yourself a little bit of money and get yourself into Prime as soon as possible, please. So this Excel spreadsheet, we're not going to show you the entire template, but if you'd like to know more information, we're going to ask you to please reach out. There's the information on the left-hand side of the screen, safety@iopsa.org. Remember, these templates are free to you. If you're not an IOPSA member, we will still give you these templates, but you don't get the free training like IOPSA members will get. If you want to get in touch directly with us, it's either safety@iopsa.org, info@ohss.co.za, or you can send me a WhatsApp to 071-875-2070. Please always remember, if you are a health and safety practitioner that is listening to these Toolbox Talks, you do get 1 CPD accredited point from SIOSH. And if you are a PRB member, you get 0.25 PRB CPD points. So that means 1 CPD point for the entire Toolbox Talk month. So coming up next week, we're going to be talking about COVID-19. Is it still valid? What do you have to do? And can we give you some templates? Of course we can. We've got the documentation. We've done it for other clients. If you'd like that information, we want to give it to you so that you can start implementing it. Then appointing a SHE-Rep. How do you go about appointing a SHE-Rep? Now, it's going to be a snippet out of the Prime course, because if you are on Prime as an IOPSA member, you'll be going through the entire SHE-Rep course over the next month. But then we're also going to take a snippet out of that on how do you actually appoint a health and safety representative according to your general administrative regulations. Then we're going to be looking at incidents and accidents and completing an Annexure 1 form. Some guys don't know how to complete an Annexure 1 form. So if you don't have somebody in your office that knows how to do that, please get them involved in that Toolbox Talk, where we will take you through the step-by-step process of completing an Annexure 1 form for the recording of internal incidents and accidents. And then lastly, at the end of the month, we'll be looking at the legal appointment side. What type of legal appointments do we have? Are there different ones for companies in terms of shops and offices, as well as in the construction area or even mines? And how do you go about doing your legal appointments? So we'll show you that, as well as give you some templates for that. So again, the safety thought for this week, in fact, that we try to have for the past 2 weeks, especially on DSTRs and risk assessments: take 5, stay alive. So we look forward to seeing you next month. We hope you have an absolutely amazing week ahead. We know load shedding is hitting every single person, but you got something to smile about because although it's cold, we have definitely, hopefully, warmed you with this Toolbox Talk. If we haven't done so, send me a message and tell me how I can change that. And again, if you have any questions, please reach out, go to our website, get in touch with us. If we can do something for you and not charge you, that is our goal. That is what we really want to achieve.